Hi everyone, and welcome to our lunchtime session, which is Meet the Cardiomyopathy Community. I'm Ali Thompson, Head of Services.
I'm Christie Jones. I'm the Community Peer Support Manager.
We hope you're enjoying our first ever online conference today, wherever you are in the world. Hi, from our offices in Chesham in Buckinghamshire. So what we wanted to talk about a little bit about today was some of the work that myself and Christie do at the charity, which is supporting people and getting people to interact through peer support so that we can build the community around the community. So we hope you find this informative, and we hope that we see lots of you joining us to become volunteers or media case studies to share your experience, strength and hope.
Yes, a big part of what we do with peer support, like Ali says, is to build that sense of community and really to make sure that no one affected by cardiomyopathy feels alone. And protecting your emotional well-being is as important as protecting your physical well-being. And as a result, we develop our peer support services so that people can come together and feel like they're part of this big family and have that emotional support that they might otherwise not have. Yeah, all the things on the slide here, I will pass over to Ali to go through.
So one of the things that we find with our charity and our community that's so important is being able to meet other people who have a similar cardiomyopathy, whether that could be dilated, hypertrophic, any of the cardiomyopathies, being able to speak to somebody with a cardiomyopathy such as yours, somebody who's having a device implanted like an ICD or maybe an LVAD or CRTD. We find that being able to talk to other people who know what you are going through, they've either been through it themselves or they've experienced it recently. So it's about being able to empathize with people. So a number of ways that we do this is through our support groups. So we have a number of support groups throughout the UK. But because of the global COVID-19 pandemic, all of those physical meetup groups are now meeting online and have been for quite a while. And one of the beautiful things about that is that people can literally join us from wherever they are in the world. And we have, so the support groups, we have trained volunteers who lead the groups. And we usually invite a speaker. So that could be a clinical speaker, such as one of the cardiologists you heard from this morning. It could be a psychological wellbeing practitioner, psychologist, mental health practitioner. It could be somebody who gives talks, advice and information on well-being, such as healthy diet, healthy lifestyle, and that kind of stuff. So we have different speakers, and then the time is given over to kind of meet online as our people would normally meet in person at a physical meetup.
The great thing is that the catalogue of groups that we have, whether it be a regional group, based in the UK, or in one of our condition-specific groups, so I think the sound was a little bit off there. What I'm saying is our catalogue of groups that are available is constantly growing. So check back up, and we'll put the link afterwards, but check back on our website. There's always new groups coming up. COVID-19 has given us the opportunity to develop new condition-specific groups, as well as an emotional well-being support group. So do check back regularly, because there will be new groups popping up.
Another service that we provide is our one-to-one peer support. Another service that we provide is our one-to-one peer support service. So that's where you can speak to one of our trained volunteers one-to-one. So sometimes people want to talk about issues that they don't particularly want to discuss in a group setting. They don't particularly want to discuss with other people. So the community peer support volunteer, telephone volunteer, is an ideal choice. Our volunteers can speak to you either over the phone, via text, email, messenger, whatever works for you. We also have our fabulous helpline. So one of our core services here at the charity is our helpline, and it's open UK time, 8:30 till 4:30 every Monday to Friday, and it is staffed by cardiac specialist nurses. We also have a closed Facebook group in which our nurses are present again Monday to Friday during those times. So the helpline is really useful if you want advice and information on clinical or physical health. We also provide welfare and benefits advice. So if you have any questions about any benefits that you might be able to claim, or if you're having difficulty with your employer, we also provide help with that as well. And we also provide, obviously, our emotional support, which is not just with our volunteers, but also our wider services charity team, who will provide emotional support and a listening ear when you need it. One of the difficulties that the pandemic brought to the charity and to our cardiomyopathy community specifically is that people were getting fed up with hearing about COVID-19 everywhere they looked, in the newspaper, online, on the TV, every time they went out of their house. People were talking about COVID-19, which obviously is understandable. But one of the difficulties with that is that people felt that they had nowhere to kind of turn to, that there was nowhere that they could get some kind of respite from. So we developed the weekly coffee and catch up. So these are exactly what the name suggests. So every Friday, 2 p.m. British Standard Time till 3 p.m, myself and Christie and some of our volunteers, we hold a coffee and catch up, which you register to attend through Eventbrite. And it's just like we're talking now through Zoom. And that isn't particularly structured like a support group is structured. This is just an opportunity to kick back, have a moan, have a laugh, meet others, just to kind of just talk about your day and how you feel and what's going on for you, or just to talk about anything. We've had some pretty wacky subjects, I think it's fair to say.
Yeah, I mean, some of the feedback we've been getting for the coffee and catch up has been really fantastic. People have said that just having that hour on a Friday to have a real laugh and chat about everything from crisps and snacks to alternative medicines to what's on TV at the moment, it's just a bit of an oasis, a little bit of calm in an otherwise turbulent week. And again, you're building friendships within the cardiomyopathy community, and that's essential to everything we do. And it's just an easier, more relaxed way of doing so. And it's been great fun for us to host as well, hasn't it?
It certainly has. One of the core elements of the charity is keeping our community up to date. So we work with a group called our Clinical Advisory Group, which is made up of a number of globally renowned cardiologists, heart failure nurses, cardiomyopathy nurses, transplant nurses, different people. And that gives us access to kind of the latest research, information, advice, whether it's COVID-19 specific, any new drugs or drug trials that are coming out. So we are in a position to be able to pass that knowledge and that information on quite quickly to you, our community, which is what we do via our website and through all our social media channels, which include Facebook, Instagram, Twitter, and LinkedIn. So if you're not following those, it's probably worth giving those a follow, just to keep yourself up to date with what's going on domestically in the UK and globally as well. One of the, so with our charities, obviously Cardiomyopathy UK, we look at and we work with and support people affected by any cardiomyopathy. So we are not specifically one type or two types of cardiomyopathy. So whether it's LVNC, ARVC, restrictive, hypertrophic, dilated, Takotsubo, myocarditis, any of the heart muscle diseases and any of the cardiomyopathies, we are available to kind of help with regards information, clinical advice, support, and also emotional well-being and welfare. So we really are the experts in the cardiomyopathy field, charity-wise. Another core component of our services and our support networks is that we support families. So we recognise that when somebody has a diagnosis of cardiomyopathy, it's a little bit like dropping a pebble into a pond. There's a ripple effect. It's not just the person who's been diagnosed who is affected. It's obviously their partner, it could be their children, brothers, siblings, friends, parents, work colleagues, teachers, educators, whoever is involved in that person's personal social network could be affected by the condition. So we always find that kind of giving that emotional support and advice to the wider family, and also to employers where it's required, or educators, teachers, we're always on hand to do that. So we support the person's wider network, and not just the person who's diagnosed. And I think this is quite important here. And when I say this, I really do mean this. I mean, we are leaders in cardiomyopathy research, cardiomyopathy knowledge, both clinical and mental health, psychological well-being. But we do have a family feel. It's kind of strange because Christie and I, when we're usually talking like this together every Friday, we usually have sort of a raft of a whole screen of faces in front of us from people who know us. They're like, oh, how's it going? So there is very much a family feel to everything that we do. And we know people's pets, we know people's kids, we know what's going on, and they know about us too. So it is a very big family, which we hope to grow further. But with that family feel, we are still able to kind of be world leaders in cardiomyopathy knowledge and research. So just touching on some of the support elements of support that we provide, the services. Do you want to go through? Yeah.
So kicking off with support groups, which Ali's touched upon already. These moving forward, these will be a mix of online and in-person groups. Currently, everything is online using the Zoom platform, fully password protected and confidential, but basically you can go to a number of our regional support groups or our condition-specific support groups. And as I said, this range of groups is always growing. If you go to our website at cardiomyopathy.org/support groups, there's a full list of groups that you can join. All of them are completely free of charge. And the beauty of the current online format is that if you're completely new to the support group format and you're not quite sure about whether you're willing to share or have people see you within the group, you can join and have yourself muted and your video turned off, and you can just listen. And if and when you're ready to speak, you're welcome to do so. But it's a great way of introducing yourself to the support group method whilst not diving in at the deep end, so to speak. But our support groups have been really, really popular during the pandemic, and we hope that the introduction of an online and in-person format moving forward will mean that we're able to grow even more groups in the future. I don't know if Ali, you want to talk about the helpline at all?
Yeah, so as mentioned before, we have our helpline that runs 5 days a week. Sometimes we hear it referred to as our nurse helpline. I think that does the helpline a disservice. It's not specifically a nurse helpline. Obviously, we do have nurses on there, but we do an awful lot more. So, as mentioned, we have the telephone peer support volunteers on hand. We have other members of staff and other volunteers with expertise and experience and knowledge in different areas. And also we have the welfare advice and support. So it's more of a holistic helpline rather than physical problems that are experienced with cardiomyopathy. So it's the physical, the emotional, and the kind of the financial as well. We have our Facebook closed groups. So we've got quite a few Facebook closed groups. We have our large capital Facebook group. We have a closed group just for young people aged 40 to 25. We have one as well for carers and somebody with the condition. Oh, sorry. Can you hear me now? I'm sorry if I keep dropping it. It's not like me, my usual large voice. Okay. Sorry, you can see me and Christie are not very tech savvy. So yeah, so that's our different Facebook closed groups. One thing I need to mention, because we do get this quite often, if you want to join any of our closed Facebook groups, you will be asked 3 questions upon entry. If you don't answer all of those questions, it's highly likely you will be declined, because we have set 3 set questions to make sure that we keep everyone in the community safe online.
I think it's I was going to say, I speak to a lot of people, a lot of service users when they first come to the charity, and a lot of people are unsure about whether or not they want to be sharing their details on Facebook, whether or not they want to be talking about their condition on Facebook. And pretty much every single one comes to me once they've joined and says how supportive and friendly our community is on Facebook. It really is. If you're having a bad day and you post and you have a little bit of a moan about what's going on, there is a raft of responses offering support, offering advice. It's fantastic, isn't it? And it really underlines everything we're about with our community peer support, that we do have a fantastic community from the world over that is there to support at the drop of a hat. And I really urge you, if you've not tried the Facebook closed group, to give it a go, because it's a fantastic place to be.
And there's always somebody online, because it's pan-international. There's always somebody away somewhere in the world. If you're having difficulties, there's always somebody there to kind of reassure or hear you. Alongside these fantastic services, we also have a service that we're particularly proud of, which we are endeavouring to grow once we are able to get back in the clinics, is our in-clinic service. So we have a number of hospitals and cardiac clinics throughout the UK that host some of our specially trained volunteers, our in-clinic volunteers. So what happens there is that if somebody's just been diagnosed, or somebody's just been told they might need to consider an ICD, and they walk out of the consultant's consultation room, then rather than going home and kind of mulling over what's happened and perhaps being in great distress or worried about what they've just been told, they can speak to one of our highly skilled, highly trained volunteers who will either have the condition or will have very close links to somebody who does. So the beauty of this service is that the in-clinic volunteers can kind of normalise and reassure, which I've actually witnessed, I've observed myself, seeing some of our volunteers do this fantastic service, and it is incredible. So instead of somebody being told that they've got this thing that they can't pronounce, and they're like, well, what does that mean? What does that mean that, you know, what's my life expectancy? All of these things going on in this person's head, and the volunteer is able to say, yep, that's what I've got. I've had it for so many years. This is how this is how I keep well. And just being able to kind of have that service is invaluable, both to our volunteers and certainly to the people that we serve. We also have, like I said, about the bespoke support for carers and supporters and people with loved ones with the condition. We also have services for, it says here, bespoke support for 14 to 25. We actually work from 0 to 25 specifically with our youth support manager and our children and young people's panel, which is a panel made up of young people with a cardiomyopathy, or again, somebody who has close links to someone with cardiomyopathy. Because we recognise that there's very little information out there for 5 and 6-year-olds, for a mum to be able to explain to a 5-year-old or a 10-year-old, or or for a 16-year-old to be able to understand themselves what their condition is, what it means for them with regards to university, work, and starting a relationship. So our services, we do have services that are specifically for children, young people, and then younger adults up to 25. And we spoke about our one-to-one support.
Yeah, so just a little bit more on how what we call our telephone peer support service works. This is a great opportunity if you're unable to, say you're quite geographically isolated with the context of the UK. If you're based in rural Scotland and getting to a support group meeting near to you is difficult, or maybe you don't drive, or you work challenging hours and you can't make it to a support group, our one-to-one telephone peer support allows you to be connected up with one of our trained volunteers with similar experiences of cardiomyopathy as yourself, and gives you that support group interaction, but just that same peer support, but on a one-to-one level. So what would happen is, if you were looking to go forward with this service, you would drop myself an email. My details are on the website. I would match you up with one of our volunteers roughly based on your age, the type of cardiomyopathy you have, whether or not you've got an implanted device, and a couple of other criteria. And after that, I would then put you in touch with that volunteer, and it may be one call, it may be 2 or 3 calls, but it's just another way of building up your support network so that you're emotionally looked after. And like Ali said, it's necessary to have a clinician, a GP, or a cardiologist that you trust, but it's also so essential to have that first-hand experience, that knowledge to hand, so that you do speak to someone with lived experience of the condition, because that really does give you that power and allows you to take responsibility of your condition. It's a fantastic service, and the feedback we receive is really amazing. And yeah, the last one that we've touched upon briefly, that's our newest service, is our coffee and catch up, which, as Ali said, is every Friday, 2 p.m. to 3 p.m. British Standard Time. And it really is just, I don't want to say a free for all, but it's really good fun. And if you've had a real kind of challenging week or a tough couple of days, then I really recommend Coffee and Catch Up, just to meet people within the community and to have a bit of fun, really. And it's also a place, there's normally a couple of really experienced volunteers in there, as well as myself and Ali. And that means that, as well as having a good time and a bit of a laugh, you do learn more about our wider services. And it's a good kind of springboard to then find out and use other services that we have on offer.
Coming in. So do you want to just have a look at those, and then we can go back to our... Okay, so we have a question here. My GP has signed me off work on ill health grounds due to my DCM, and I am waiting tests for a heart transplant. What benefits? Okay, that question again. My GP has signed me off work on ill health grounds due to my dilated cardiomyopathy, and I'm awaiting tests for a heart transplant. What benefits am I entitled to? This is a kind of difficult question to answer without actually speaking to you over the phone and finding out some more about you, because obviously when you look to apply for benefits, there's certain eligibility criteria that you would need to fulfill. So I'm assuming, because you are working, that you are not of pensionable age. So that's one assumption I'm going to make, and that you are working legally. So you are legally entitled to live in the country. That's another eligibility criteria. Okay. So it sounds very much like one of the benefits that you would, if you live in the UK, be able to apply for is PIP. PIP is personal independence payment. And that is a benefit that is available to people who are unable to work due to ill health. To apply for PIP, you would need to contact the Department for Work and Pensions, the DWP, and they will then ask you some questions, and then they send you a application form out to your postal address. That is the only way to do it at present, is to ring the DWP on a specific number. If it's helpful, I can make sure that we share that number if people want that. And then you get the big application form, and it is a big application form, come back, and we can certainly help you to complete that application. But yeah, the components of PIP are split into two parts. So there's the mobility, which is, as it suggests, if you need help with traveling, moving around. And then there is the daily living component, which is, you know, if you need help around the house, or help getting about and doing stuff, you know, like feeding yourself and showering and stuff like that. So if anybody would like to, would like me to put that number up and those details, I'm more than happy to do that later.
There are a few questions on here that are more of a clinical, more clinical questions. Those we can certainly forward to the Q&A sessions this afternoon at 3:15. But I would emphasize again that for clinical questions, it is really a good idea to make use of our helpline, Monday to Friday, 8:30 a.m. to 4:30 p.m. If you go to cardiomyopathy.org, all of the helpline information is there. But that is really your best place to go for clinical questions.
I think that there's a question here. Why were we not on the shielding list? I'm assuming when you say we, you mean people with cardiomyopathy. That has been a discussion, point of much discussion on our helpline and in our closed Facebook groups. There is differing opinion on that. So what I would suggest is we can have that answered by a clinician, because myself and Christie aren't clinicians, so we're unable to answer that, but we can certainly get that answered for you. Somebody else has put another question. I'm finding it difficult to have one GP overlooking my case. Yeah, okay. And also, whenever I see a healthcare professional, my records seem to be a mess, including one erroneous record of me having had a cardiac arrest. How do others manage their NHS support network? For that person who posted that very interesting question, I would suggest that you're not alone. That's something that we've heard from other members in our community. What I might suggest is that if you haven't already, is pop into our closed Facebook group and put that up as a question. Then you will get other people feeding back to you and saying, well, this is what I do, or this is what I've done with my records, or how I've explained it to this clinical team. Because we know that some people have, say, a neurological clinical team with a cardiac clinical team, and then the GP, and then they might have the kind of local heart failure nurse team. So you've got about 4 different teams speaking to each other. So we understand that this has been a problem for some people. So perhaps if you put that in the Facebook closed group, you'll probably get a wider breadth of answers.
Yeah, one that I might answer actually. We've got someone joining the session from Australia. Hello. With LVNC, do you have any online groups I can join? You're quite right when you say I don't know anyone else with LVNC. That we do have generally a lower number of people coming to us with LVNC than the other forms of cardiomyopathy. We don't have a specific LVNC group at the moment, though that is in the pipeline. We are looking to have that atrial fibrillation group, an ICD group if that applies to you, so implanted devices, and also an emotional well-being support group. So we do have a lot of options that may apply to you. And like we said previously, we can also set you up with a telephone peer support volunteer. And obviously with the time difference, we could do that over email. I've had quite a bit of success setting people up coming across from the United States and doing email correspondence. So if that's something you're interested in, you can find my details on the conference site and send me an email. But keep an eye on our social media accounts, because we will get an LVNC specific group going at some point. We've got another one coming in.
Okay. Hi, Ali. Hello, whoever's put this. What impact were the impending changes to benefits being dealt with a default Scottish government from existing payments by UK Gov, e.g. PIP and ESA? That's not fully known yet, simply because that hasn't been worked out at the respective parliaments as yet. But what we are looking to do is, with our website, we want to have a kind of specialist function for PIP, particularly PIP and ESA, which, so a little bit like the Citizens Advice Bureau, if you've ever been on their public site. So you have a section where you go, if you live in England, you click on England, and if you live in Scotland or Northern Ireland, you click on the respective tab, and then it tells you exactly what you're entitled to in that nation or principality. So the short answer is, we don't know as yet. The longer answer is, we will, as soon as we know, we will put this up both on the website and also through our Facebook. So we'll make sure that we do that for you. How do we, do you want to go with that?
Yeah, so very good question. How do you offer support when the office is closed? So as we said, the helpline is 8:30 a.m. to 4:30 p.m. But often, for example, myself and Ali and other members of staff are in the office until 6 p.m. British Standard Time. And beyond that, our volunteer network does often work at weekends. So, for example, if you were to get in touch with me and say, Christie, can you match me up with a telephone peer support volunteer? One of the questions I would ask you is, do you have preferred days or times for someone to give you a call? And if you were to say, I work all week, I work nights during the week, but at the weekend I'm free, I would make sure that that volunteer was available to give you a call at the weekend. So in terms of the peer support services, there's quite a lot of flexibility about providing support at the weekend, and that would extend as well to potentially to bank holidays and public holidays. We would, if you could only be contacted on those days, we would find you a volunteer who could do so. So there's no real concern with that, and you can always email me. As I said, we're flexible, we're approachable, and we'll always do our very best to help you.
Yeah, just further to that, I don't think that I've ever done a kind of 9-to-5 day in any charity that I've worked in my life. So yes, we have set times for the helpline, but support services never stop. Even over the Christmas break, there are particularly vulnerable clients that we are aware of. They might be vulnerable because they live alone. They might be, and they don't have any family. They might be vulnerable because they've been newly bereaved. So we make sure that we, as staff and volunteers, contact them over the Christmas period. So we always provide support when the office is closed, whether that's through the Facebook closed groups that obviously go on 24 hours a day. Many of our support group leaders and volunteers are available. I know that myself and Christie are also available, because what I was saying before holds true here about that familial environment. So an awful lot of people have my own personal mobile number. So, you know, they will contact me, or they will contact Christie and say, I'm having a bit of a rough time. Is there anyone I can speak to? And we wouldn't wait till 9 o'clock on a Monday when the office opens, or 8 o'clock. We would do it there and then. So the short answer is, we just provide support as and when it is needed, you know, either through holidays, through Christmas, or any kind of religious festivals, anything like that. We provide the support.
I think the beauty of it is that because our volunteer network is comprised of either people that have a cardiomyopathy or support someone who does, people completely understand that problems aren't gonna fit within the 9-to-5 bracket at all times. So people do understand and are more than happy to help. So like Ali said, it really is a around the clock support. So we'll never leave you in the lurch, so to speak. Any more questions?
No, I don't think so, not for now. But... okay. So we talked about the okay, so you know, if somebody were to say to me, why would you go to Cardiomyopathy UK for support and advice? And I think these are the reasons that I would personally give. We are the experts, or at least, you know, the charity is the expert on providing the clinical and emotional advice that is required when you have a long-term condition such as cardiomyopathy. You know, that's something that we have embedded throughout our services, throughout our research, throughout all aspects of the charity. we are the UK's leading charity for heart muscle disease. And I mentioned earlier about the clinical advisory group that's run by the charity and chaired by our Chief Executive Officer, Joel Rose, and also Professor Perry Elliott, who I'm sure a lot of you know. So the clinical advisory group are always looking at research. They're looking at anything new with cardiomyopathy, any trials that are going on, anything that we might, areas of research that we as a charity might want to consider and kind of take forward ourselves with the relevant NHS trusts. We're 31 years old, and I think that this charity has kind of stood the testament of time. For those of you who maybe are not aware of our humble beginnings, we started off as the Hypertrophic Cardiomyopathy Association by a woman named Carolyn Biro, who had hypertrophic cardiomyopathy, and she was surprised, staggered, annoyed, frustrated by the lack of knowledge and information for patients living with cardiomyopathy when she was diagnosed. So with Robert Hall, who is one of our previous chief executives, Perry, again, Professor Elliott, and some other well-meaning volunteers, she set up the Cardiomyopathy Association, which then became Cardiomyopathy UK. And the charity has always been a grassroots charity, and that's not a cliche. For us, it means that we started off in somebody's living room with one clinician on board, one nurse on board, one nurse on the helpline, and some very, very well-meaning and hard-working volunteers, and that we've grown now to kind of hosting an international conference. And I'm sure if Carolyn was still with us, she would be exceptionally proud of her legacy. So we've kind of stood the test of time. One of the important things about our charity is that people with cardiomyopathy, and again, when I say that, affected through having a partner or loved one or being the parent of or the child of someone with cardiomyopathy, their experience inputs all of our services. So we don't sit here and think, oh, well, I think somebody with cardiomyopathy might benefit from this. No. All of our services are mapped against people's needs. So our community tell us what they need. They tell us what is missing, whether it's from their physical care, their emotional well-being, or financially, their representation kind of at DWP tribunals, and when they try to apply for a benefit and they're turned down because the assessor isn't sure of cardiomyopathy. We make sure that everything we do is shaped by our services. All of our board of trustees, the majority of the board of our trustees, so the people legally responsible for the charity, have the condition themselves, so they live with the condition. The majority of our volunteers have the condition or support someone who does. So everything that we do is shaped by our cardiomyopathy community. It's not something where we randomly pick ideas. It's what we are told we need from our charity. So that's what we deliver to you. And we are respected. We are respected by NHS trusts, by clinicians. You know, if you've seen some of the people on our clinical advisory group, and also the clinicians that presented this morning, you know, they wouldn't lend their name to or they wouldn't speak on behalf of a charity if they didn't think that we did exactly what we said we did. So we are respected, our services are respected, our expertise in the third sector is respected. I think we've got let's have a look at this one. Yes, okay. So question here, are there any plans to offer volunteers for Cardiomyopathy UK training to be able to better support people? Absolutely, I can say that categorically. So in October, the end of October this year, we have an online course coming out called the Skilled Helper. how to be a community peer support volunteer, which would enable you to be a telephone peer support volunteer, a support group leader, an in-clinic volunteer. And that training course is all online and it is certificated. So anybody who wants to do that, please get in touch with Christie or myself. And we'll put you down on that, put you down to do that. The modules are all about the kind of, so we look at Rogerian methods of offering support, so empathy, congruence, unconditional positive regard, how to sit with people in distress, how to, you know, if you have somebody who's particularly angry and they're taking it out on you, how to kind of be with that person and recognise the anger apart from the person and to provide effective support, how to look after yourself and your own well-being, your emotional well-being, supervision. And also about the different policies, so safeguarding, anybody who you might come into contact with via the charity, and also looking at kind of how we can keep you safe and keep our work confidential and of a high quality. So yes, it will be out at the end of October. So please do email me and Christie or ask us on Facebook, and we will be able to kind of get you on that. Okay, I was diagnosed with HCM following an out-of-hospital sudden cardiac arrest in May. I have my first appointment with my cardiologist next Friday. That's good. What should I expect? Is it going to be carried out over the phone? I'm not sure what to expect and what questions I should be asking. I don't know whether it will be over the phone. If you've had a letter, then it would have said on there. But if not, then I would certainly ring the cardiologist secretary as soon as to kind of find out. I think when the questions that because bearing in mind that you probably in reality will only have probably 8 to 10 minutes time with any cardiologist. So if it's an NHS, if it's a non-private appointment, then I would certainly make a list the night before about anything that's worrying you, any increase in symptoms. So if you find that any of your symptoms are becoming more problematic, I would maybe make a note of those. Anything that's causing you to be more breathless. So any kind of increase in symptoms. I don't know. Yeah, of course you can.
So Ali's quite right about making a list and really preparing for it. But if you're really not sure where to start, our support nurses do often deliver at our events a session called Maximising Your Appointments. So if you get in touch with our nurses on our helpline and say to them that you've got an upcoming appointment, they will help you formulate some questions and give you tips on, because often you'll only get half an hour or even less. And they will be able to help you maximize that time so that you don't come away from the appointment feeling like you've had a missed opportunity to ask something. So do give them a call on the helpline, or you can email them. The address is supportnurse, all one word, @cardiomyopathy.org. And just let them know that you've got an appointment coming up and they will help you get the most from that appointment.
I don't want there to be any confusion. You probably won't get half an hour. I think you will get the 5 to 8 minutes.
Yes. Optimistic.
We're a little bit nervous. You can see we don't normally do this. They only wheel us out occasionally. Okay. Okay. Having been a member of the charity since it was formed, what patient input has or is there in clinical support services? So one of the things that we're doing at the moment, I don't know if you've seen, is the Change Makers project. So that is a fully funded project which is bringing in volunteers with expertise to actually work with clinical commissioning groups to influence local and national policy, both within NHS trusts and eventually Whitehall. So that's one of the ways that we kind of bring our volunteers and our people with lived experience into our healthcare and clinical services. Obviously our in-clinic services, They are volunteers volunteering physically in a hospital and or clinic. We also have volunteers who sit on steering groups at different research trials and different ideas for research. So there are myriad ways in which our volunteers and our supporters can get involved, and do get involved quite regularly with kind of looking at working in clinicals, providing support in clinical settings. Okay, yeah, so this next question, does Cardiomyopathy UK offer any training for healthcare professionals to help them better understand the condition? We absolutely do. So every year we run a HCP clinical study day. So that is, as it suggests, that's a day purely for clinicians working working with cardiac patients, and they are given extra training and hear from experts all about different modalities and kind of thinking about cardiomyopathy. So they would have stuff on early diagnosis, looking at ejection fractions, but obviously a lot more complex than, because obviously I'm a lay person. One of the things that we are doing at the moment, and that we've made great strides with, is that we are bringing out the first cardiomyopathy specific training, online training module. So this is going to be a huge training module, which is with certain clinicians at the moment to be looked at, which will train nurses and clinicians at registrar at different levels, whether it's a registrar, somebody with a specialty, a heart failure nurse who's just coming into kind of the team, or just specialising. So that will be looking at all the different types of cardiomyopathy, prognosis, genetics, treatment, looking at, particularly with genetics, looking at family pedigrees and stuff like that. But it's very, the course itself, I mean, I could never have written it. It's our colleague, isn't it, who's kind of created the whole of this conference. He's been doing this number of senior clinicians, so we're very excited to be able to roll that out soon. I mean, it won't be a one-off piece, it will be a dynamic piece that we will add modules to, obviously, as the condition changes or the conditions change. So too do the learning outcomes and expectations placed on clinicians to know more, to be able better able to diagnose and stuff like that. So yes, that's something we are committed to doing. Are you doing the same work in Scotland as health is devolved and not overseen by Westminster? Okay, so we do have a number of professional links and relationships with Scottish-based clinicians. And I know that some of the key area works that we've been looking at is around the Scottish inherited cardiac conditions pathways. That is something that our board of trustees is particularly looking at, and we know as a charity that we need to kind of certainly improve the work, or improve the work that we do in Scotland, as well as in Wales, as well as in Northern Ireland as well. So Scotland is very much on our agenda. One of our trustees lives in Scotland and is particularly keen, and say particularly, we're all particularly keen, but he's particularly connected to different clinicians, so that we are bringing those onto our clinical advisory group and looking at how we can ever expand our work, duplicate that work into Scotland. One of the things I need to point out is some of the projects that we have funding for are England specific. And I know that if you apply for certain projects in Scotland, it's a very different kind of ball game because obviously it has a different charities commission, but we are certainly engaged with Scotland-based clinicians and the kind of politicians and pathways up there. So watch this space. And if you indeed have any information or any help you can give us to kind of realise that goal, we would love to hear from you. Just Oh, is this recorded so I can watch the session again later? I missed some of it whilst getting lunch. I don't blame you. That's a good excuse. Yeah, absolutely. We'll make sure that you can hear this again. And what I think I might do is save you listening to us two wallabies rattling on. I might as well do a Q&A, so you take these questions and answer them fully. So the questions that I can't answer because I'm not a clinician, I will get those answered for you and have those put up. So all of the questions that have come through, you will have an answer to. Yeah, I think, I've got there we go. So the last slide. So like I say, we are empathetic, highly skilled. I wish I hadn't said that now. I'm sitting here going, you're too far away from the microphone. Okay, we are empathetic. The majority of us are highly skilled. I'm not so sure about us two, but we're the highly skilled staff team, volunteers, trustees, clinicians. And we do care. That's the end of the day. We do care. And I know that sometimes people say that and you think, oh yeah, we do. We love our community. We have so much fun with our community. It is a family. So we are committed to what we do, and we try to. I hope that it shows that we care. I hope that it does the work that we do. When COVID-19 hit, obviously, everyone in the world, businesses, charities, everyone had to kind of formulate a very fast response. We were no different. But our key priority or key difference to, say, a business or another kind of conglomerate is that we have people who we care about, for people who COVID-19 could be particularly disastrous, whether that's their physical health or their emotional well-being. So we recognise that we absolutely needed to get a response out quickly. So we did that. We did that through the website, making sure that our president, Professor Elliott, could give us all the information that he could and advice about COVID-19, specifically with cardiomyopathy. Also, we had an employer's letter co-authored by our chief executive and also, again, Perry Elliott, to explain to employers who perhaps weren't being as understanding as they possibly might have been with staff members affected by cardiomyopathy. We put all of our services online. We developed the coffee and catch up very quickly because we knew that people needed some respite, some kind of downtime, and some just general laughter and jokes and a bit of kind of, to kind of get away from it all emotionally for a little bit. And like I say, we are a family. That kitchen table where Carolyn Byro 31 years ago started the charity. We're not sitting around a kitchen table now, but the ethos hasn't changed. The needs of our charity to do what's right for our kind of service users haven't changed. So
it does sound like a bit of a cliche saying that we're a family, but when I started working for the charity and I realized that people could call in and ask to speak to a specific person or email a specific address, I wasn't used to that. I'd been in touch with charities before where you'd receive an email back saying, thanks for getting in touch, here's your ticket number, we'll get back to you within this amount of time. You really can email Ali, you really can email me if you're not sure where to go, and if we can help directly, we will. And if we can't, we'll put you in touch with someone at the charity who can. So it really is that personal experience. It's reaching out to a friend. It's like reaching out to a family member. And we're just more than happy to help, aren't we?
We are. We are indeed. So we don't have any more questions. We're coming to the end of our presentation. If you do want to hear more about our services, or you're not feeling great in yourself, if stuff's not going good for you, then please, me and Christie are here. The helpline is here. Do pick up the phone, do email, do Facebook, and we will help you. You have my word. We will help you.
And if you feel like you want to help others and you want to become a volunteer, we'd love to hear from you.
We really would. Yeah, we really would.
But enjoy the rest of your afternoon and your future sessions, and we'll speak to you soon.